I mean, the studies there that ocular melanoma runs down to your liver within 5 or 10 years, but then those numbers changed the last year or two also.
Well, I would tell you, look, I don't know about that aspect of your case. I don't know the stage of the melanoma. I would just tell you that our program is very successful with melanoma, as I talked during the first case tonight of kidney cancer, melanoma, sarcoma, where the success rate is actually very high with radiosurgery. So, that's the beautiful thing about radiosurgery. We're able to hit the cancer without hurting healthy tissues. So in your case, they used a different technology and your eye was hurt. With our technology, we're able to hit the cancer in general without hurting healthy tissues. So I would urge you to give us a call. You can call me after hours. Our number 212-CHOICES, 212-CHOICES, which is 212-246-4237. And better yet is to come in and spend some time and discuss everything, go over all this data in person so you can see, God forbid, and I have a couple of men right now who are getting treated for metastatic prostate cancer, and it's in the bones. And while we can treat the cancer in the bones and relieve that area, it's a lot better to be treated once and be cured.
Thank you, Doc. I appreciate your information. I'll look forward to seeing you.
God bless you, and thank you. We're going to hear from two new voices now, and then we'll be right back to take your calls.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and I think we have Ernest on the line. Is that correct?
Yes. Good evening, Dr.
Hi.
Lederman.
How are you?
I'm just fine. I want to ask you: is it feasible to use radiosurgery if you've had prostate cancer and you come down with something else like bladder cancer?
Maybe.
Can you use it?
That's the beauty of radiosurgery, that we're able to aim at a particular area without harming other areas. So we'd have to look at your case, but there's a good track record. We treat many people with bladder cancer, and unfortunately, many people come to us thinking that surgery is their only option. So there are other options, and in fact, data shows that people who want to save their bladder and quality of life, which is a big quality of life issue, certainly should give us a call.
is what you have unique, or is it is it available at, say, Dana-Farber or these other cancer centers?
Well, we were the first ones to do body radiosurgery, so we have done the most. We were the first. We've done 20,000 patients. A lot of people, unfortunately, say they do the same thing, but usually it's not the same thing. A lot of people, when they're said, Dr. Lederman does it, they say, oh, I do it too. Yeah. But when we see that and we look at the records, we usually see that the people are getting standard radiation. Most commonly, they're getting standard radiation. Yeah, it's frightening Googling, and it looks like removing the bladder is sort of the next step if you happen to have, if it gets to that stage. But I guess that is not necessarily so. So I'm so glad I heard you on the radio, because it's nice to know that that's an option. Right. It's nice to know that. And people should understand, just like for women with breast cancer, you do not need to lose the breast if you have breast cancer for most women. And I remember Dan Rather, and 20 years ago when Mrs. Reagan had breast cancer, he got on the air in the 6 o'clock news and he said, Mrs. Reagan has breast cancer and therefore she's going to have to lose her breast. And I called up CBS News and asked to speak to Dan Rather, and I said, breast cancer doesn't mean you have to lose the breast. And bladder cancer doesn't mean you have to lose your bladder. There are options, and you should get a fresh second opinion. That's the only way you're going to really learn about options. Detect it. In other words, if you've already had prostate cancer, wouldn't it be sort of in order to get CAT scans on a regular basis just in case you have bladder cancer? Because sometimes if you end up getting it, it can be like stage 3 or 4 by the time you discover it. Wouldn't it make sense? Isn't that sort of the protocol to have? No, not necessarily. No, because number one, stage 4 means it's metastatic, widespread. For the best detection of bladder cancer is to look inside the bladder. And a CAT scan is not equal to that. So I see. The human eye is better than a CAT scan. Oh, I see. Thank you very much, Dr. Lederman. Right. God bless you, and thank you. And just a reminder, if you want a package and DVD about our work, just call us at that 212 Choices number, and we'll mail it out to you. There was a recent article about bladder preservation, trimodality therapy with radiation, focused beam radiation, using some chemo, and sometimes using some surgery to scrape off the cancer. And actually, studies have shown that people who have a complete response or a near complete response do equally well. This was a study that was published in the last weeks and written up by Alice Goodman. For patients with muscle-invasive bladder cancer, bladder-sparing approach is well-established alternative to cystectomy. And for some reason, many people think that bladder cancer means you need a cystectomy. It's not necessarily true. So again, it's one of those diseases where I'd urge you to come on in, give us a call, come on in, and let's talk about your case. Let's try to save your bladder, your way of life, your urination, and for men, more than that, sexual function as well. So it's a very important topic. And for everybody, bladder cancer is one of those that often is related to smoking. So if you're a smoker, we'd urge you to stop smoking today. So we have another call. Grace is on the line from Brooklyn, whose sister has breast cancer. Good evening, Grace.
Good evening, doctor. I have a question, actually, because tomorrow I'm going to see my sister. She lives in Poland, and she's very sick. And she had one breast. She had surgery on one breast removed, and now for more than 2 years she had chemo constantly, radiation. And because of chemo, now she has a fungus in her mouth and went to her stomach. And I want to know, because they never tell me what is the prognosis. And she's now she can't move, she can't eat. She lies in a bed for almost 1 month. Wow. And I'm very scared for her. So I'm going to see her tomorrow. I'm actually leaving. She doesn't speak. She can't speak. Her voice, she can't communicate. So I don't know, doctor, what do you think? You're going to Poland to see her, or she's coming to the United States? No, I'm going to Poland because she's very sick. When she got cancer on breast, they removed her breast and they find out that the cancer was spreading. That's why they was pumping so much chemo in her, radiation and all that for 2 years. And she never got a second opinion because I told her to get a second opinion like you said, but she never, I don't know why, and I'm really scared. I want to know what is going on.
What I'd suggest is this. I'd suggest you go to Poland and you make a list of things that you should bring back with you. Bring back the pathology report. So let's look at what the cancer looked like under the microscope. She probably had CAT scans or PET scans. Bring those back, the reports and the disc, and we'll review it with you. We'll have our radiologist review it and give you an opinion about the prognosis. Fungus superinfection is a complication of chemo or antibiotics, so that's not necessarily directly from the chemo. But let's see if there's another solution for her case besides endless chemo. 2 years of chemo seems like a lot of chemo, and it sounds like she's not tolerating it very well. So try to get the pathology reports, the CAT scan and PET scan reports, and bring the disc so we can actually see the images. And then give me a call when you get back. We'll review it all and give you a report.
Okay. Do you think, doctor, she will get through this? She will survive?
I don't know her situation, so I need to know more about her situation. So give me those reports. Give me the most recent CAT scan or PET scan, the pathology. If you have any other tests, blood tests or cancer markers, you can call me tomorrow at our 212 Choices number in the office, and we'll talk more about what exactly to bring back. Bring it back, bring her records back, and then we'll review everything and see if we can help her.
I can't call you tomorrow because tomorrow I'm leaving. I'm going to be there on Tuesday.
Well, what time are you leaving tomorrow?
Tomorrow I'm leaving afternoon.
Well, we're in the office. You can call us at 8 in the morning. You have plenty of time to call us.
No, but I don't have anything. Anything. I don't have it here.
Okay, well, you just bring us back all the information, and then we'll meet when you get back, okay?
I am. Okay. All right, doctor. Thank you so much.
All right. God bless you, and thank you.
Thank you, doctor. Bye-bye.
Okay, good night. Safe travels. And we have another case that's interesting. This is a case of a tale of two cities. Why? Well, you'll see in a minute. This is a man about 50 years old. He's a producer and a professor. He had lung cancer about 2 years ago and was doing great. This past autumn, the lung cancer traveled to the brain. He had a seizure. He went to a hospital. And before he knew it, he says, they opened up his head and removed one of the two tumors. And then he found out about us and came to us for radiosurgery of the brain cancers. So one cancer in the brain was partially removed. One was left behind. So what happened to him? Well, we treated both. We avoided whole brain radiation, so we avoided the harm to the healthy brain and the hair loss and late neurologic effects from whole brain. And we know that when we give few treatments just to the cancer area, it's more effective, about 90% versus 50%. And he's done great, except for one thing. He's a diabetic, and the wound where they opened up his head broke down. And now he's going to have a second surgery to repair the wound that has really nothing to do with the cancer. His cancer seems to be in remission. So it's kind of a point of, if you had the choice between non-invasive radiosurgery or open surgery, which would you prefer? And sometimes we don't think about it or don't think we have time, but usually there is time to get a second opinion. And in fact, we have something called the Urgent Cancer Consultants, where we promise to see you within one business day, because we know often your cancer is critical. You don't want to sit at home and wait. So we promise we'll see you within one business day. Even if you have to work harder, we don't mind, because we think that's good for the patient. For this man, he's in remission. Unfortunately, he's got to have a second surgery to repair the wound of the first surgery, but thank God the cancer is in remission, and otherwise he's doing well. So think about this man, a man, tale of two cities, and think about sometimes non-invasive treatment like this man or the man with kidney cancer, how it can change a life. We're going to be back in just a minute. We're going to hear from our sponsor, the man with the golden voice, and then we'll be taking your calls at 1-800-321-0710. 1-800-321-0710. Thank you. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple board-certified radiation cancer